everybody. Welcome to Ask an Expert. This is Jessa here with you this week, and we are so lucky to be joined by Dr. Maureen Kelleher. I will give a quick introduction to Dr. Kelleher, but first, Maureen, thank you so much for taking the time to be here. Once I do your introduction, people will understand how busy you are, and we're just so grateful that you're taking the time to help teach us.
Thank you. I'm super happy to be here.
So before we dive in, to give you guys some background information, Dr. Kelleher is an equine veterinarian and she specializes in equine sports medicine. She's an associate professor of equine sports medicine and surgery at the Ohio State University College of Veterinary Medicine, which is also a gift to us because just in talking to Maureen leading up to this, I mean, it's one thing to be a very skilled practitioner, but being able to explain things is a skill set in and of itself. And Maureen definitely has that. So that is to our benefit this evening. And previously, Dr. Kelleher also held a faculty position at Virginia Tech's veterinary school. And she has many years of experience working in a private sport horse practice that predominantly has worked with upper level show jumpers, show hunters, dressage horses, event horses, race horses, you name it. She helps owners maintain soundness in their horses and prevent work-related injuries. So we'll talk a lot about those topics tonight. And she's also very interested in the latest technology and research used to diagnose and treat sport horse injuries in horses. So that's a lot. And there's more than enough for all of us to get into. As always, if you're here live with us, one, please say hello in the comments. Tell us where you're viewing from. And also don't hesitate to use the comments to ask questions or, anything that you want to say there. We like to know that we're, in company. And so feel free to use that chat feature however you like. To start, Dr. Kelleher, will you just tell us where you're located and what your day-to-day kind of is these days, because I know you have a lot on your plate, including a horse of your own.
Yes. So I am at Ohio State University, which is in Columbus, Ohio. And my day-to-day varies a little bit. My appointment here is predominantly clinical, which means I mostly 70% of the time are seeing patients that come into the hospital. And because my specialty is lameness and poor performance, most of the cases that I see are related to either lameness issues or poor performance issues, etc. I also do a little bit of teaching on the veterinary curriculum and occasionally have some research projects going on in the background. So that's my work life. And my personal life, I do have a couple of horses. One is my main riding horse, and he is a thoroughbred gelding, and he raced for many years and then came to me happy and healthy and has, knock on wood, remained that way. And we do 3-day eventing.
Amazing. That's a lot of different things going on, which I know is, I consider like a personality trait when people like to be doing a lot of things at once. To me, it sounds like it would keep things interesting.
Yes.
There's definitely a lot going on. You mentioned horses coming in for lameness issues and poor performance issues. Yeah. What falls under the umbrella of poor performance issues?
Yes, that's a fabulous question. So, and this, I think, needs a little bit of attention because I think it speaks to the fact that horses are good communicators and we are poor listeners sometimes. And there are times that riders or trainers or owners will say something's just not right. And if it's minor enough, they may ignore it, and then it may become something major later on. The people who say, okay, something's just not quite right, and I'm going to investigate this, that falls under poor performance. So it could be that you're noticing that in a particular dressage move, the horse is just not, maybe he was able to really sit down on his hind end and, you know, propel himself forward or do a piaffe or a passage or whatever. And now he's really struggling to do that. It's really hard for the rider to get that maneuver like they used to be able to get the horse to do it. And so, but if I just go look at the horse, trot on a straight line or trot on a lunge line, it looks sound. But that doesn't mean there isn't a problem there that we need to investigate. So that would be more musculoskeletal. You know, the horse doesn't feel doesn't feel right. Now, there are circumstances where the horse will not feel right and it doesn't have anything to do with the musculoskeletal system. It could be a cardiac or a heart problem, or he could be having some respiratory issues or upper airway issues or stomach issues, gastric issues. And so my job is to look at the horse, get all the information from the owner. I usually start with a very thorough physical, like musculoskeletal exam. But if we're really striking out on finding anything musculoskeletal, then we may, you know, go down the route of looking at doing a gastroscopy or doing an upper airway examination or doing some blood work or doing a muscle biopsy to see if there's some other system that is causing that horse to back off on his work capabilities.
Okay, that makes a lot of sense. And I'm sure, just wait 1 second. I'm getting feedback. Okay, that makes a lot of sense. And I'm sure that that can present itself in a million ways and there can be a million different findings. It sounds like a bit of an intimidating thing to bring to try to diagnose, but also as the owner to bring to you and be like, let's figure this out. But that definitely clears it up. I hadn't heard it described as poor performance issues in the past. So to start, I'm planning on approaching this conversation starting a bit high level and getting more granular as we go. And certainly redirect me if some of these are far too general and we can just go down whichever specific path is appropriate. But I'm curious if we can start, if you'd be willing to share some of the most common injuries that you see in dressage, eventing, and show jumping horses, and whether those are similar across disciplines or very unique to each of those disciplines.
What I will say is any horse can probably hurt anything. However, we do see some generalities. You know, if we do research on injury prevalence, we tend to notice trends in certain sports. So for sure, if we talk about the dressage horse, the hind proximal suspensory region is a big area of concern. And we can evaluate that really quickly and say, okay, what does the dressage horse do that might be different than a jumper or an event horse or something like that? And they do have to, I mean, their whole sport is getting down and really sitting and working off their hind end. So certainly they're going to have more propensity to injure those hind limb structures than they would, say, the forelimb. Not to say that they can't do that to have injuries on the forelimb, but as a group, potentially we're going to have some more hind limb issues. Now, you could say, okay, well, hunters and jumpers also are using their hind end a lot because they've got to propel themselves over jumps. But I think there's a little bit more to the jumping horse than the dressage horse, as far as not only do they have to push off on their hind end to get over the jump, but they're also landing with all of their body weight on their front limbs. So they're going to have more of a mixed bag of injuries that could be both a hind limb and forelimb. Okay. And I think a lot of what that divides into is probably very horse specific. A horse that's got a weaker hind end is probably going to have more hind end problems. And a horse that is really heavy on the forelimbs is probably going to have more, landing problems. And then for the event horse, just because depending on the level, they're doing a little bit of everything. They've got to do dressage work, and they've got to do cross country, and they've got to gallop, and then they've got to do some show jumping. We see a lot of the same injuries, but because of the gallop work, we tend to see some tendon and ligament injuries like superficial digital flexor tendon and deep digital flexor tendon in the forelimb, just because they've got a little bit more gallop work to them.
That all adds up based on what those disciplines demand. One question we got from our member, Amber, she asked if any of these injuries have become more prevalent in recent years, despite, those disciplines have not changed. So I'm curious to hear if there are any that are more prevalent.
I would say actually, if anything, we're probably making better strides at decreasing the prevalence of those injuries. And I know the focus here is not going to be on racing animals, but certainly even in the racing industry, we are, I know there's a lot of media attention about the injuries in racing. But I think overall, there's probably a trend towards more education and more research that shows that we're probably going to trend downward on some of these injuries because we're learning more about how to prevent them and how to use the horse and rehab the horse.
I love to hear that. So, some positive news. Of those injuries that you have covered so far, and this is going to be a bit of a loose guess, but what percentage would you say are preventable with the right training, recovery practices, activities, etc.?
Yeah, honestly, probably more than people want to hear. I think the hard part with especially some of the suspensory injuries is some of the underlying issues with that is horse conformation. And on the forelimbs, foot conformation, and even on the hind limbs, some foot conformation. And I think until we get some of those things better organized or people are recognizing foot problems and foot imbalance more, we're still going to see those soft tissue injuries. I lost track of what I was saying. I apologize.
No, you really actually tied a bow on the answer to that question.
So
I would take it as positive that most of those injuries are preventable, because then there's if we equip ourselves with the information that we need, there's hope, there's a little more control over the outcome.
Yeah, exactly. So certainly any acute trauma, like my horse tripped in a hole or slid because there was a gopher hole or hit a jump really hard because we came into it unbalanced, that stuff is going to happen. But, chronic repetitive injuries are a common cause for horses to have tendon, ligament, and joint injuries. And so if we can keep the body better balanced, then they'll be able to handle that chronic repetition better, and then not have so many of those injuries happen.
Okay. Let's talk about, and this will probably be a lot like the meat of our conversation. Let's talk about some general best practices for injury prevention. And I know some things only come into play at a certain level, but it'd be great to dive into those as well, and really just get kind of the lay of the land of what we can control and should be controlling as horse owners.
Yeah. So for me, the number one thing is the horse's feet. I'm sure everybody has heard the no foot, no horse adage, and that's true. And I think, and I'm not here to bash on any farriers because we need them and we love them. But there's a lot that you as the horse owner can do to foster a better relationship with your farrier and end up with a better product, right? And so a couple of things you can do with your veterinarian to also improve your horse's foot balance. And so I think a lot of injuries can happen because the horse's toe gets too long, or their heels get too underrun, or they get a little bit of imbalance inside to outside. And it may start as a very subtle thing, that maybe you don't pick up on it, or the farrier doesn't even pick up on it. But then as the foot is trimmed almost the same way each time, then suddenly 3, 4, 5 shoeing cycles later, the foot looks different. There are some horses that are going to have a propensity to grow a really long toe and no heel. That's very, very common in thoroughbred horses. And there is a lot we can do to keep that toe from getting too far out in front of them. And there's a lot we can do to try to encourage some heel growth and get a more normal hoof balance to the horse. The other thing is the cycle between the visits of the farrier. I think if you probably looked in most books, it's going to say your horse needs to get its feet done every 6 to 8 weeks. And I would say that really, really depends on the horse. And if anything, they probably need to have their feet done every 4 to 5 or 4 to 6 weeks and not 6 to 8, because that interval of growth is going to really change the dynamics of that foot. If you think about how much foot that might come off once it's trimmed and reshod, if you go 8 whole weeks before that hoof is trimmed and reshod again, there's a lot of change that can happen. Now, there are horses that are very slow growing in the hoof category, and so maybe 8 weeks is truly an adequate time period. But if you have a performance horse that you're competing or you want to stay sound, then decreasing that interval so that there are not such big changes in the hoof between one trim and reset and the next trim and reset, because all of that translates up the leg to the body. And so if the horse has got a longer toe, the whole length of the stride is going to change. How much weight bearing they have on the foot connecting with the ground is going to change. And so if we keep changing that drastically every weeks, then we're definitely going to be more prone to not just foot injuries, but other types of injuries in the leg.
I have a question on this, and it's something that I always personally struggled with, is beyond choosing a farrier that came like highly recommended by people I trust, I wasn't educated enough to identify the horse's angles are correct or incorrect, or there's no heel, or the toe's too long.
Mm-hmm.
And I'm curious, as an owner that's feeling those things, what are your recommendations? Like, should I be finding resources to educate myself so I can start like training my eye, or what do you recommend so that owners aren't just kind of like, let go and let God being the farrier in this case, and just kind of trust that the right thing is happening so that they can have more like true oversight into what's going on in something that's so important?
So I think the number one thing is that most people are never there when their farrier is working on their horse. And so first of all, I think getting to know your farrier is pretty important. Number one, they are passionate about feet. That's what they do for a living. And if you talk to them about feet, they're going to want to talk to you. Now, you probably have to choose the time to talk to them, because if they're super busy, maybe they don't have time. But if you're there while your horse's feet are being done, that's a very good way to say, hey, can we have a discussion about, like, I want to learn about my horse's feet. is this okay? Is that okay? Is this something we can change? Is this not something we can change? How often do you think we should trim this horse's feet? So I think building that relationship is utmost. Now, I will also say I've worked with a lot of farriers in my day, and I have worked with a lot of very good farriers, and they all have things that they're good at and things that they're not so good at. I'm a veterinarian. There's stuff that I don't do well. Like, I mean, even in the horse world, I don't want to diagnose a pregnancy in a mare. That's not my thing. But if you give me a lame horse, I'm all right. But, and so even with farriers, there are going to be some feet that they're spot on. They know how to trim that foot. They know how to shoe that foot. They know that type of horse, and they do a great job. But you might throw some other kind of weird conformation at them, or a horse that grows its foot oddly, and they may struggle to keep a shoe on that horse. Like, they just can't seem, the horse keeps throwing the shoes, et cetera, et cetera. Doesn't make that farrier a bad farrier. It just makes him not ideal for your horse, which means you probably need to have a talk with that farrier and say, I feel like we're struggling here. Do you think that this is a horse that somebody else would be better suited? Like, I would say most farriers, not all, but most farriers understand that we all want what's best for the horse. And if they're not the best choice, if I'm not the best person, the best vet for your case, then I'm more than happy to find you the best person for that. And I would hope, and I think most farriers would also help you in that endeavor. The other thing, so relationship, and then having a conversation and making sure that the farrier you have is the best farrier. And I know that can be difficult because some places out there in the world don't have a lot of options. So you may have to do the best you can, which means you're going to have to educate yourself as well. And so, if you don't have a lot of options and you need to know more about feet, then you're going to have to find resources. And luckily, I think there's a lot of resources out there that are very good that the horse owner can look into to find out some information about taking care of their horse's feet. Now, as a vet, one of the things that I often stress is to get farrier balance films, or films, radiographs of the horse's feet, x-rays of the horse's feet that show the foot balance. So it's usually a x-ray from the side, which is a lateral projection, and an x-ray from the front, which is a dorsal projection. And between those two, we will be able to see the hoof pastern axis, and we'll be able to see the balance from the inside to the outside. And sometimes looking at it, just looking at the horse's leg and foot, we don't see how bad that imbalance might be. Sometimes we can tell, but sometimes it's really good to get x-rays. And if people say, well, how often should I do that? I would say minimum once a year is to get those x-rays. Now, if your horse has really good feet, maybe you don't have to do it every year, maybe every other year, maybe every year and a half. If your horse does not have good feet, if your horse is a thoroughbred that has a long toe and a low heel, I would say maybe you should think about doing it every 6 months, because the more even slight little tendencies to be out of balance are going to increase your risk for injury. So besides working with your farrier, I think working with your vet to get balance films of the feet is probably my big points to take home.
Amazing. I love that point because I've never heard of that before. And it makes a lot of sense. So those are images that you look at, you review them with your vet, and then you bring them back to your farrier with notes.
Yeah, exactly. And even, in some situations, again, most of the farriers and veterinarians probably know each other in a particular area. So even asking your vet to have a conversation with your farrier. So it may not, it's not just that you necessarily have to have a good relationship with the farrier, but if your farrier has a relationship with the vet, all three of you guys can be in contact with each other to make sure that what the horse needs is what is achieved.
Yeah. And is there any relationship to when you switch farriers, getting those images like at that point, or is the cadence of like at least once a year sufficient?
I think it probably depends a little bit on what's going on with the horse. So if, for example, the horse has been going pretty good and you move from someplace else to Ohio and you need to find a new farrier, then the new farrier might say, hey, let's get some fresh ones so that I know where I'm starting. But if if the horse is having some problems, then, and for some reason, sorry, that was my phone. I thought I shut it off. If you're having some problems, like some soundness problems or some hoof problems, or you're working with your current farrier and trying to decide whether you need to move to a different farrier, then yes, maybe even if you just had some films done a month or two ago, but you're changing farriers, or you're trying to see that there's a change being made, then you may have to get it more frequently just to make sure you're on the right track and that the changes that you're making are working.
Okay. I love that. It just feels very empowering for the owner and the vet and really the whole team together. Like you mentioned, the three of you working together. Okay. So shoeing is a huge pillar of injury prevention.
Yes. Yeah.
What is the next pillar that we should dive into?
Yeah. So I think probably the next thing that I get a little bit on my high horse about is what I call readiness to work. And that can take on a couple of different faces. So one thing would be to say, okay, this is my horse and I know that he has some arthritis in his pastern. And I know that every 6 or 9 months, I have to have the vet come out and inject his pastern to make him feel better and for us to keep doing our job. And you can fill in the blank: pastern, coffin joint, hocks, stifle, whatever. And so any of the joints, any joint that has some osteoarthritis means that that joint is not going to work as perfectly as a joint without osteoarthritis. And usually there's some stiffness and reduced mobility to that joint because maybe the joint capsule is tight. Maybe the collateral ligaments that support that joint are stiff and tight. Because there's been some bone changes, because there has been some cartilage changes. And so if I know that that joint has a propensity to be stiff, then I want to warm that joint up. Now, I think a lot of people probably do carrot stretches or stretch out their horse's front leg when they put the girth on, and think that that's going to get them kind of loose and ready for work. And definitely that helps. And I do encourage people to do carrot stretches and that kind of thing to get the spine warmed up and ready to move. But you could also do some warming therapies to any of your particular joints that may be stiff and arthritic. So if you've got a 15-year-old horse who's got some hock arthritis, then you may need to put some hock boots on for half an hour before you ride to really generate some warmth and heat in those hocks, and then go out and spend a good 15 or 20 minutes walking that horse around and really getting those joints mobilized. And so before you work, getting some mobility and warmth to the tendons or ligaments or joints that might need a little bit of extra help is good. And then when you're done riding, so after you're done warming up and done all your exercising, if you have particular areas of the body that you are concerned about, again, any joints that may have osteoarthritis or maybe an area that had a previous tendon injury, then I apply cold. So cold boots, Cold hose. Cold hose is not the greatest because it really depends on how cold the water is coming out of the hose, but ice boots or something like that to kind of cool down and decrease that inflammation. But I do try to stress really getting their bodies ready to work. If you think about if you were going to go out and do some exercise, go running for the next, I don't know, even a 3-mile run, you usually stretch, you usually move around a little bit so that you're nice and loose and warmed up and ready to go. So we just need to make sure to do that with our horses, especially as they get older, give them a lot more time at the walk before we're asking them to do some hard work.
Is there a rule of thumb in terms of walk work? I know as they get older, we would increase it, but is there like every horse should be hacked for at least 15 minutes before we start asking them any real work?
That's a good question. I don't think there's much probably science behind my answer at all. And I think that it's probably going to depend a little bit. There's lots of horses that come out ready to rock and roll and do their job. And then there's probably some who are like, oh, I don't even want to get out of bed this morning, so leave me alone. I would say a good minimum 5 to 10 minutes of walk work is probably what you're looking at. Now, probably everybody who's listening says, oh yeah, for sure, I do 10 to 15 minutes. But if you actually timed yourself, it probably would be a lot less than you think, because it always seems like we're walking forever. And then we're like, okay, we're good now. And then you just move on and you've only really walked 5 minutes, or whatever. So I was telling you earlier that my horse is 15 years young, and recently realized it took a little bit more for him to kind of be ready to do harder work. And so I now set a timer on my watch when I get on, and I don't let myself do anything but walk work until that timer goes off, to make sure I'm keeping myself honest. And I will do some other things in that walk work. So after he's walked for a while, maybe on a long rein, I do pick up the reins and maybe do a little lateral work, do some shoulder in, shoulder forward, that kind of stuff, do some circles, etc. And then give him some more time to stretch his neck out after that. So back and forth between a little collected work and a little bit of long rein work, but at least I'm making sure I'm just walking for a set amount of time.
We have a comment in chat about this, and I was actually curious about the same thing. I believe she's referring to a suggestion that somebody made on, I think it was Ask an Expert, especially like in the winter. Like if you're getting to the indoor arena and both you and your horse are freezing because you're walking around and like no one is getting warm. She said, like, horses are flight animals, pick up the trot and warm yourselves up. What is your thought on that? I think you've already shared it. Like, we should be walking long enough, but maybe just share a little bit more insight into that.
Yeah, so it's actually a good point. And I guess I should say lots of walking is good, but if it's below 0 in upper parts of Canada and you're freezing, then certainly doing a little bit of something that's going to warm up the rest of the body is also going to be helpful. I guess my add on to that is, get yourself kind of moving around at the trot, maybe on a lighter, looser rein, just to move the muscles and move the body around, especially if it's cold. But make sure you do enough of that before you ask for any strenuous work.
Okay, cool. And then let's talk about cold therapy after riding. Does that apply to any previous injury that your horse has had? The ideal would be an ice boot on that injury, even if we're, no issues since the recovery.
Yeah, pretty much every soft tissue And I do sort of throw joints into the soft tissue category because there's a lot of soft tissue surrounding them. They never heal 100% normal. Just the nature of how wounds or trauma heals is that the collagen in those structures does not come back the same. And so it's never going to be as strong as it was before it was injured. And so with that, there's going to be some stress and strain on the area of that injury that has healed a little bit not normal. And so I am a pretty big advocate of putting some ice on all of those structures if it's at all possible.
And going back to like having a hock boot on beforehand to warm that joint up if there's ever been an issue there, would that apply? Like, are there boots made for other joints as well? And if your horse is like getting hock injections or injections in other joints, are all of those joints things that you should be considering, like getting physically warm before you ride?
Yeah. So if hawks are pretty common. I think the biggest problem area to actually warm up before you ride is going to be the stifle, because there's no wrap really for the stifle. But if you think about the neck, if you think about the back, if you think about the pelvis, so lots of horses have sacroiliac problems. You can put a warming blanket over them and warm that area up. Now, just like we were talking about getting out and riding when it's freezing cold, if it's 97 degrees outside and 90% humidity, you're probably not going to put a warming blanket on them. But if it's a more temperate condition, then you may want to. But it doesn't hurt to throw, if you've got a horse with a back issue or a horse with an SI issue, it doesn't hurt to throw the saddle pad over that area for 10 or 15 minutes, even on a hot day, over that area, and get some warmth going, even if it makes them sweat a little bit. Get some warmth to that area when it's hot out. And for the knee, for the ankle, for the foot, the pastern, like I said, the hocks, all of those, you can find commercially available boots that will help warm things up. The stifle is going to be the toughest one. If somebody wants to be very dedicated, they can do a hot or a warm towel compress on those stifles. That's a little bit labor intensive, but some people are good at labor intensive jobs in preparing their horse to ride. The other thing you can do with the stifle is, while it may not be very easy to warm it up, you can do some passive range of motion exercises with the leg to get the leg mobilized without a lot of work on it. So just standing there. So a lot of stretching the stifle forward or back, or flexing and extending it. So in horses that have stifle injuries, I usually tend not to do the warming so much with heat, but do it with some passive range of motion exercises.
Okay. We have a question in chat about brushing and whether that adds any warmth that we're talking about.
So that's good. I think on the body, the one thing I will say about brushing is stimulating the skin. And anytime you're stimulating and moving the skin around, it's going to bring blood flow to the surface. And so, yes, that will help. Mostly, I think, again, this is probably not scientifically proven, but mostly I think that's going to help on the body where there's more muscle right underneath that skin tissue. When we get down into the legs, certainly if you had a soft curry or something that you were doing on the leg, maybe it would bring some blood flow to the skin, but it's probably not going to do as much for the joints and the tendons and ligaments. And you probably aren't going to be brushing with the same vigorousness on the legs. At least I know my horse won't tolerate that. That you would on the body, but certainly on the body, it's going to bring some blood flow to the surface of the animal for sure.
Okay, great. And On the topic just of heat, I'm trying to segue here to a question we got ahead of time. Macy said, I'm interested in Dr. Kelleher's thoughts on the risk-benefit analysis of using protective boots as well as standing wraps in regard to thermal injury.
Okay. This is a good one. So I am so on boots, okay? And I'm going to take racehorses off the board. In young horses that are going through growth and development. So in thoroughbred type horses up until they're like 3 or 4 years old, and in warm blood horses up until they're 5 or 6 years old, I try not to use protective boots. And I know this sounds a little bit silly, but things will only strengthen to the amount of support they have. So the leg, the limb, the structures are only going to develop up to the strength of what's supporting them. So if you don't have that protective boot on there, then it's not going to limit the amount of growth and strength that structure can attain. Now, we're probably not talking about huge measurable differences. Like if I have this yearling filly and this yearling filly, and I train one with protective boots and the other without protective boots, is it going to drastically make a career difference between the two of them? Probably not. But in my mind, I want those legs to be as strong as possible and limit how much support they get accustomed to. Now, if you've got a horse, like I have a younger horse that bangs his fetlocks together behind. That horse has always had to wear boots on the hind because otherwise he just creates sores by whacking his fetlocks together. So certainly there are going to be situations where you should be wearing boots because not wearing the boots is going to be more traumatic than wearing the boots. So that's in the young horse. In the older horse, I think it really depends again on how you feel about it. I don't think that there's any boot that's going to prevent a acute traumatic injury from happening. So again, if you're out galloping on the cross country course and your horse slips in a hole, I don't care what boot he has on, there's enough torque and force from the horse's body falling into that hole that whatever injury is going to happen is going to happen. Now, if you're doing a lot of work and your horse tends to get puffy legs, you could use compression socks while you ride, or compression socks not while you ride, but after you ride. So there are some boots and some compression material that I do recommend, especially for horses that may be prone to swelling or edema or anything like that in their legs. I'm not a huge boot user if it's not necessary. Now, again, running cross country, if your horse has studs in, you're going to want boots on because you do not want a stud injury. But if your horse is barefoot and doesn't, you don't need to worry about a stud injury, and he's not prone to hit his front legs on the jumps or something like that, then there's probably no reason you have to wear the boots.
Okay. I feel like
all over.
The boots decision is almost like one of those charts you can follow. Like yes to this, no to this, and you get to what you're looking for. But it's really good to know it's not like, never put boots on your horse. It's not one of the main causes, it sounds like, of the injuries that you're seeing coming in, but it definitely is a topic of conversation. So that was a helpful description. I want to make sure I get to some of these other questions that people sent in ahead of time. One is from Kim. She said, I'd be curious to hear what she has to say about horses with bowed tendons and their long-term soundness or limitations. Kim has an OTGB who was retired from the track due to a bow, but has not taken a wrong step since, being brought back to work with a slow, methodical plan. And their goal is to go to novice level. So what are your thoughts on bowed tendons, and how would you think about that in a horse that is aspiring to have a future eventing career or any career?
Yeah, so that's really good. And bow tendons are not an uncommon injury for a horse to come off the track. And honestly, there are lots of horses that get bow tendons on the track and get rehabbed and go back to being race horses. So that is definitely a tendon injury that can be rehabbed, and the horse can come back to do a very physical work. Now, there are some bowed tendons that are bad. And I would say, if there is a lot of trauma and it is not dealt with in the healing phase well, then that horse may have trouble. I mean, there are probably some horses that if they have a very bad bowed tendon, may never come back to any athletic career whatsoever. But I think for the most part, most superficial digital flexor tendon injuries or bowed tendons have a fairly good prognosis to come back for a high level of activity. So I would say, if the horse is doing very well and responding well to treatment and if you're taking a slow, methodical plan, then I don't have any reason to believe that horse couldn't come back to do novice or higher.
That's great. And your discussion about readiness to work, I feel like, was applicable to that as well. Lee asked a question. She is curious about footing and shoeing. And of course, you've already covered shoeing. She said, is there anything in arena building and footing that helps or injures horses more than others? And then she also asked if anybody is studying this, because she would love to do more research.
Yeah, there is a lot of research on footing. And I would say a lot of it is because of the racing industry. But a lot of those surfaces are also surfaces that we ride performance horses on. So there is research out there about footings. And as far as footing goes, it's really the extremes that are the worst. So certainly nobody's going to go ride or work their horse on asphalt or concrete or something super, super hard like that, or that's less than ideal. And then same thing goes for like something that's very soft, like very deep, soft sand or deep mud or something like that. So those would probably be sort of the extremes. Can they go through short spurts of mud or short spurts of sand? Certainly. Can they go cross the street over asphalt? Sure they can. But if you're working on those hard or soft surfaces repetitively, then yes, there's a propensity that you could have an injury. So certainly when we think about very, very hard surfaces, we're going to have more foot injuries, more bone bruising, and joint injuries because of the hard concussion. And then for the very deep, soft sand, then we may have more soft tissue injuries because the horse has to really work hard to get their leg out of that deep sand and back into it, and then they kind of sink into it. So we do see some soft tissue injuries when they're chronically worked in really deeper footings. So the footings that are the best are really sort of the middle of the road, grass, and a sand arena that's just well maintained and has a really good underbase, but not a super thick sand over base, but enough of support without being too deep. A lot of synthetic footings are quite good. Again, they're good at taking up some of the concussion of the ground, but without making it so hard for the horse to work through the surface.
We have a question in chat. I apologize, I can't see who the Facebook users are, but somebody on Facebook said, my barn uses a lot of gravel, like in the round pen, the paddocks, etc. Is my horse at greater chance of injury because of that footing?
So I guess it would probably depend on the kind of gravel, because I would say like soft, like pea gravel rocks are actually not a bad footing at all to work on. I mean, it's not great, but it's a nice even footing that's a little bit giving. In fact, some people will put laminitic courses on some form of pea gravel. If it's like road gravel, that's going to compress down the more it gets worked on. That sounds like it may get hard over time, like start softer and get harder over time. So I would probably watch that surface just to see if you're starting off really kind of hard, where it's not so hard, and then as it gets compressed down, it doesn't have any give and it's becoming more like a hard top. The other thing too, I will say, is if the surface is consistent, then most horses will get used to it. So while if you've got an area that you like to work, and it's if you're in California and it's in the middle of the summer and the ground is hard and dry and you don't have a lot to water with, then you may have to be a little bit more conscientious, but your horse is probably going to be a little bit more adaptable to being on hard ground more than a horse on the East Coast who's used to being, near a softer ground, and their feet will adapt, their hoof will adapt to the moisture in their environment and will kind of toughen up. So there's probably some exceptions everywhere on like the firmness that they'll tolerate.
That's interesting too, because I mean, you see people like scratching at shows because like if the cross country footing is, quote unquote, not good, but it's interesting to know that it could be, that could be a horse specific decision, and how that horse will take whatever state the footing is in. We have a question in chat that is similar to one that I wanted to get to, and I want to dive into the topic of technology. And my question that I was going to start with is, what technologies do you endorse for maintenance or rehab? And I'm going to lump that in with this user's comment or question, which was, are there any common therapeutic treatments that you consider a waste of time? So take that as you will.
Okay, a waste of time. Okay, so there's so much stuff out there that's available to honestly, through your vet, and then also through like lay physiotherapists or certified physiotherapists, but non-veterinarian physiotherapists. And so off the top of my head, I can throw out shockwave therapy, laser therapy, pulse electromagnetic field therapy.
These are all endorsed.
Yes, so far. Yes,
Okay.
so far. For, I guess, in particular situations, shockwave, absolutely 100%. Now, that is something that can only be done by your veterinarian. You have to be a veterinarian in order to purchase a shockwave and use a shockwave. Because there is a big analgesic effect. And so certainly we don't want to mask anything too terrible that might need to be addressed.
And is shockwave for treatment or prevention, or both?
Treatment. That's going to be a treatment for sure. Not to say that I haven't used it as a preventative in horses that I know have a particular, for example, this is a great example. So an older dressage horse that has Cushing's or PPID and can't have his hocks injected with steroids because of the risk of laminitis because of their Cushing's disease or PPID. So in that horse, I need to do something to manage that horse's chronic hock osteoarthritic pain. And Shockwave is awesome for that. Now, I usually start with a series of 3 Shockwave treatments spaced apart a couple of weeks. And that's sort of my base treatment for, okay, we can't inject the hocks anymore. We're going to do Shockwave. But I may not do the 3 over and over again. I might say, okay, in 6 months, when we normally would maybe inject the hocks, if he's feeling a little bit creaky, before he gets too creaky or before he gets sore, let's Shockwave his hocks just once. So there is some circumstances where I might do it as a preventative. But predominantly we see it used in soft tissue injuries, tendon ligament injuries, and then for joint, for decreasing joint pain. For laser therapy runs the gamut because, again, there are different classes of lasers, and the higher classes of lasers can only be purchased by a professional, like a medical doctor or a veterinarian. But it doesn't necessarily mean that that laser is better than a lower class laser. It just means that it's more dangerous. So has more propensity to cause thermal damage or eye damage if you point it in your eye or your horse's eye. So there are plenty of lasers out there that are not class 3 or class 4 lasers that may be a little bit more accessible and do just as good of a job. And then there are the things that are called laser that are not really lasers. And so there are lots of products out there that if you can go on the internet right now and buy it for your horse, then it is not a laser. It's a light-based therapy. And so most of those are not lasers. Those are LED type of light-based therapies. And those I'm so on because I know that a laser, depending on the wavelength of the light, has a certain depth associated with it. The LED lights don't typically have very deep penetration. So, and horse skin tends to be thicker. So, depending on the area, you may not be doing anything but you may not be penetrating anything but the skin. Now, if somebody says to me, I have this light-based therapy and my horse seems to like it, then there's no danger in it. And it would be a means to do some warming therapy. So if you've got a light-based wrap that goes around your horse's knee and your horse's knee is arthritic, then go for it. You're not going to hurt anything. The pulse electromagnetic field therapy has, there's lots of brand names out there, and they have different types of technology, but they all are essentially creating a pulse between an electromagnetic field. And I do really like that. That is going to be a nice preventative as well as a treatment. If anything, it's going to just help decrease pain and inflammation and help, again, bring some blood flow to the area of application. What else did I say? I can't remember all the ones I listed.
No, those are the 3 that you listed.
Okay.
Are there, I mean, this is kind of a dicey question. Are there any that you're just like, you see them out in the market? I know, I mean, even you mentioned lasers that like you can buy yourself might not do that much for you. Is there anything else that falls into that category? Or are those therapies that you just mentioned kind of the ones with the highest efficacy and that you would take the most seriously at this point?
Yeah, that's probably a good way to put it. There are lots of other things out there that I do like and I do recommend in like particular situations. I can't think of anything that I would be like, eh. I mean, TENS is something that you can get over the counter. Like you can go to Rite Aid or Walgreens or whatever and get a little TENS unit that like Shaq endorses on TV. And to me personally, there's not a lot of research for use in horses. Again, it's probably not going to penetrate much deeper than the skin. But I do know a lot of people use those on their horses and again, seem to feel like the horse becomes more relaxed or seems to enjoy it or, again. So while I don't, in my mind, it doesn't seem like it should work. But I'm not going to knock it. It shouldn't hurt the horse as long as you apply it slowly and get them used to the tingling sensation and don't just zap them. There's probably no ill effect of using it.
Great. Okay. That's definitely first and foremost and good to know. Well, I've kept you for an hour and it flew by because it was like an action-packed hour of learning. And this whole time I've been kind of just like very grateful that you are giving us your time because I mean, I just know that you have very busy days and a lot of people who would love your time. So thank you so much for spending it with us. I know that people listening are going to get so much out of this and they'll be calling their farriers and, warming up a little bit more thoroughly going forward. So we really, really appreciate you taking the time, Dr. Kelleher.
No problem. It was lovely to chat with you all.
Thank you. And thank you to everybody who attended. We will